Aspirin-associated gastroduodenal bleeding. Aspirin is a well-known cause of gastric and duodenal mucosal toxicity, particularly gastrointestinal bleeding, which is associated with considerable morbidity and mortality among patients. How to manage aspirin-associated gastroduodenal bleeding? If a patient develops a gastric or duodenal ulcer, while on low-dose aspirin therapy, consideration should be given to stop aspirin. Although discontinuation of aspirin is the first attempt to manage gastrointestinal bleeding, an important question is when aspirin can be restarted, as patients on aspirin therapy usually need to take their medication for life. If aspirin is still indicated, restart aspirin approximately 3 to 5 days after initiating therapy with a gastric acid suppression medication. Implementation of gastric acid suppression therapy is the next critical approach for managing aspirin-associated gastroduodenal bleeding. Gastric acid suppression drug of choice. Randomized trials have shown that ulcer healing occurs more rapidly with proton pump inhibitors than an H2 antagonist, misoprostol, or sucralfate. How long should patients with aspirin-associated gastroduodenal bleeding take a proton pump inhibitor? Duration of treatment with proton pump inhibitors depends on ulcer location, ulcer size, severity of the initial clinical presentation. The duration of proton pump inhibitor therapy should be individualized based on the size of the ulcer to optimize healing outcomes. For ulcers less than 1 centimeter, especially for duodenal ulcers, proton pump inhibitor therapy should be continued for 4 to 6 weeks. On the other hand, for ulcers more than 1 centimeter, especially for gastric ulcers, patients should receive 6 to 8 weeks of proton pump inhibitor therapy. Secondary prevention of aspirin-associated ulcer. Following completion of an appropriate ulcer healing duration of therapy, an important concern is whether the patient should receive maintenance proton pump inhibitor therapy or not. Following completion of initial gastric acid suppression therapy, maintenance proton pump inhibitor therapy is indicated in patients who must remain on aspirin, or who must resume aspirin. The benefits of proton pump inhibitor maintenance therapy for secondary prevention of low-dose aspirin-associated ulcer considerably outweigh potential risks of long-term proton pump inhibitor therapy. In addition to discontinuation of aspirin and gastric acid suppression therapy, evaluation for eradication of H. pylori, and endoscopic follow-up are other pharmacotherapeutic approaches to manage aspirin-associated gastroduodenal bleeding. All patients' H. pylori status should be assessed, if not done previously. If positive, appropriate therapy for H. pylori should be instituted. Endoscopic follow-up is not necessary to assess ulcer healing for duodenal ulcers. However, endoscopic follow-up should be performed to assess healing of gastric ulcer if malignancy had not been excluded at the initial endoscopy. Thanks for watching. If you found this helpful, hit the like button and please subscribe to get future video lessons.